My name is Elizabeth Sequist. I'm from the University of Minnesota. I think there's growing evidence that hypoglycemia is much more common than we previously recognized. I think looking at clinical trial data from the past would say, 10 to 15% of people, maybe 30, depending on the type of diabetes, have hypoglycemia. But if you look at population-based data, we know that nearly all patients on insulin have hypoglycemia during the course of a month, sometimes many more times than once a month, so it is very common. Well, type 2 diabetes is treated with insulin, and so all of those patients who are treated with insulin are at risk for developing hypoglycemia. I think it is less of a problem because they're able to respond to a low glucose by shutting off their own insulin secretion. But especially in people who have advanced type 2 diabetes, who have very low levels of insulin secretion, it's a very common problem, particularly in the elderly. To reduce the burden of hypoglycemia on our patients, one thing we must do is help all practitioners recognize they need to ask their insulin-treated patients about hypoglycemia at every visit. The other thing that needs to happen is people need to be aware that insulin doses need to be adjusted very carefully over time. You can't keep people on the same doses and assume they're going to have the same responses. If they exercise more, they eat less, they can get hypoglycemic. So people have to consider all of these factors as they're taking care of their patients. One thing that can help clinicians and their patients avoid hypoglycemia is using some of the new technologies. Continuous glucose monitoring has been shown in study after study to reduce the risk of hypoglycemia, and it's becoming a very commonly used tool in the treatment of patients with diabetes. There also is growing evidence that some of our newer insulins have less hypoglycemia risk than others, so doctors might want to consider whether they're using the right type of insulin for their patient. And clinicians can think about what kind of insulin they're using for their patients. In the U.S., we have had such issues with expense, and so people have been moving to old-fashioned NPH and regular for many of their patients. But we know that newer insulins, like the insulin analogs, Lispro, Aspart, and also the longer-acting basal insulins, U300 and Degludec, both seem to have a lower risk of hypoglycemia when used in appropriate doses than the old-fashioned insulins like NPH and regular.